Hey guys, welcome back to my channel, Ash RN Takeover. I just want to check in, and first and foremost, I want to say thank you. I want to say thank you to. I'm literally lying in my bed right now. I really should get up, but I'm so exhausted. Like, I don't know. These are trying times, man. These are trying times. Um, I just want to say thank you. Thank you to everyone who's been lending an ear, those people who have been supporting me, checking in on me, praying for me, um, extending their gratitude. I appreciate you. I really do. I just want to take this time to kind of like answer some Q&As or do a Q&A rather and answer some questions that I've been getting in my inbox. I said that I would do it a while ago, or I would make a video on like what it's been like being a nurse, a critical care nurse during the COVID-19 crisis. But I don't think I want to comment on that yet, honestly, because for one, I haven't had enough time to reflect on the matter. I'm still living through it. I still have my own stuff that I need to work out, and some realities that I still need to face and deal with and cope through. Um, I can tell you a little bit about what I'm experiencing. I'm experiencing nurse burnout, compassion fatigue, caregiver strain. These are all like real things that I feel like I'm dealing with. But like I said, I'm not in a state of mind to really comment on that so much or like to do an extensive video on that. But I will at some point, hopefully. We'll see. Um, but let's get on into these questions. I will answer them to the best of my abilities, and we'll see. We'll see how it goes. Definitely need to pull that up. Um, okay, so obviously the question number one was what's it like being a nurse during COVID-19. I already touched on that question, and um, like I said, I'm not really going to answer it or go into too much depth. But what I will say is this: it's been stressful, to say the least. Um, Definitely stressful. Definitely depressing and exhausting, physically, mentally, emotionally draining. Um, it's really draining. I'm not even gonna lie about that. It's really depressing. Um, it's also humbling. I'm grateful and fortunate that I'm even able to offer my services and show up and be able to be in a position to help others. That's a gratifying feeling. But overall, like if I could sum it up into one word, it's stress. Um, yeah, it's stress, and that stress has not subsided yet. So that's that. I've literally had what today's my second day off. Yesterday was the first day I was called to work, and I said no, and I didn't feel guilty about it. So I'm just I'm just taking it all in, and I'm just taking some time for me to kind of just relax and catch up on sleep and just bum it. Like I literally all I've been wanting to do is just bum it. Like just stay in bed, eat, sleep, watch Netflix. That's really drink water, deep condition my hair, things that I haven't really been able to really do. Like I would sleep, but I would never feel rested. It was always a go 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 feeling, especially because I was picking up so many hours because other people were getting sick, and I was like, that's actually a question on here too. Are like healthcare workers getting sick with COVID-19, and are they testing positive? Yes, they are testing positive. Yes, they are getting sick. People are dying. This is like a real thing. Um, Fortunately, I don't know anyone personally who has died, but there was um, a physician in my facility who passed away. So that was unfortunate. But yeah, like you get called in because they need staff, and if other staff members are sick or deciding to retire right now or whatever the case is, cool. um somebody has to show up. So I've been that person, and now I'm just kind of taking a break or a step back from that. Uh, I will skip ahead to one of the questions says, "Did I get sick?" Mm. Mm. Yes, I did get sick. I'm not gonna lie about it. I did get sick. Um, my symptoms were very, very mild. I'll do a video on that separately. Um, but yeah, I did get sick. Did I test positive? No, I did not test positive. I tested negative. I did get tested. It was negative. Do I think that those test results were accurate? Probably not. The test is not 100% accurate. It's like closer to like 60% accurate, if I'm not mistaken. And that's a large margin for error. Not to mention there are like a lot of different strains right now. I think there are like 7 or 8 strains of the virus. So I don't know. Things they don't tell you. Um, who knows? Maybe that the testing kit was only like targeting a certain type of strain. I don't know. I really don't know how it works. But yeah, it's not it wasn't fun. That's all I will say. I got really sick and it was not fun. Are there a lot of deaths? I'm not gonna answer that, but common sense will tell you yes. Um, I've experienced a lot of death in such a short amount of time. I don't think that's normal. I don't think that's okay. People are dying at an exponential rate. Prognoses are poor, and it just sucks. It's really shitty. I'm not even gonna lie. Like I don't even know what else word to use, but it's shitty. It sucks, and it sucks, and it sucks. Um, and it sucks to know that you're doing all you can for your patients and they're still dying. That's I feel like it's like you can't save them. I know I'm not God, but anyway, it's sad. It's really sad. Um, hmm. Is there really a lack of PPE? Yes, there is really a lack of PPE. In the beginning, I remember not for nothing, we were using like probably not conducive with anything. It probably didn't make sense, but back we were scared. We were scared. We were using like plastic bags, like literally to make them like makeshift shoe covers. Like we were improvising. We were doing our again. This is back when they told us, "Hey, you don't even need a mask." Anyway, we're not even gonna get into that. They were saying, "Oh, you don't need an N95. All you need is a blue surgical mask." Anyway, moving on with life. Yeah, still a lack of PPE worldwide. This is a thing in my facility. Are we still experiencing it? Yes. Overall, yes. Personally, I can say that I've been fortunate enough to always have an N95. Um, at this a clean new N95 at the start of every shift. There was a time where people were reusing their N95s for like a week straight. That was the week I was like, that was the time where I was out from work. But yeah, and I'm a size small. Small is like, not a lot of people wear small. So I don't know. It's always been available for me. I'm fortunate. Shout out to Central Supply. To the people who aren't as fortunate, I feel for you. I really do. But yeah, that's that. What is PPE? What does standard PPE look like during COVID? Come on, man. Really? Come on. Y'all don't see the pictures? Okay, so I'll tell you this. There was a time where we were in bunny suits, but bunny suits I'm definitely getting too many messages right now. Um there was a time where we were wearing bunny suits, then bunny suits, we didn't have no more bunny suits, so we couldn't wear something we didn't have. They were soiled, you gotta get rid of them. Then we had like surgical gowns, then we were putting blue plastic gowns over those surgical gowns. We have our gloves, we were double gloving, shoe covers, hair covers, like hair bonnets, um, goggles, face shields, N95s, then blue surgical mask over that. That's what it's really supposed to be, or that's what we've been doing. That's what I've been doing. But then there are days where you don't even have that. You go in with your blue surgical gown, you go in with your N95, your blue mask, and some gloves, and you call it a day. You show up and you do what you can. And you just try to stay safe. That's really what it is. You try to stay safe. Next question. free food. Do you guys really get fed every day? I guess you know what it is. It's because I've been posting so much of it. I've been posting like every meal that has been donated, and I'm so grateful. Uh, Hashtag feed your nurses. Hashtag thank your nurses. I've definitely been I've definitely been uh promoting that. But yeah, no. So most of our food is like donated from like local restaurants who see how much we're doing and how hard we're working, and you know the long strenuous hours that we're putting in. And then if it's not from like the local restaurants, it's from friends and families of nurses who are donating to our units. They just want to make sure we're fed. So that is cool, and I am grateful. um yeah. uh Skincare, and there's like I didn't really understand this question honestly, but it was I think what the person was trying to ask is like how has my skin been during like, I guess, like from wearing the N95 or whatever the case is. Well, here's what I say. I get stress, acne, and like I said at the beginning of this video, it's been stressful times. So acne, acne, well, I don't really have on this side so much, but I have like some acne on my chin. It's not like I don't really get crazy acne, but it's noticeable. It's definitely noticeable. I notice it with the lighting. You can't really notice it, but can't really tell. But yeah, no, skin has been super dry. Um, a tip, I definitely recommend that you gotta moisturize, man. Moisturization is key, especially at the bridge of my nose. I had like skin breakdown there. It was tragic. I scar easily and I bruise easily. So even after like maybe, sure, can you just stay up for like 2 seconds? Okay. So I bruise easy and I scar easy, and even if I wear the mask for like maybe like a 20 minutes or so, like it's already like indentations on my face and such and such and such and such. So I've been using like a hydrocolloid dressing here to kind of like combat that. And when I don't do that, because that's irritating in itself, I don't know, like it irritates my eyes. It makes my eyes water. Even when I'm not doing that, honestly, I'm just like, I'm doing what I can. Like if I could take my mask off for like 2 seconds, I am. If I go outside, like I want to say outside, I mean like outside of the unit, and like into like a clean area, I'll take my mask off, keep my blue surgical mask on, and that will like alleviate some of the pressure that I'm experiencing. So that's cool. I've been doing that. Honestly, this whole thing has just been rough, and I just encourage people to stay home. Don't let what all of these frontliners, myself included, don't let what all of these first responders and healthcare essentials do be in vain. Do your part. That's really what it comes down to. Just do your part. Stay home if you can stay home. And even if you can't stay home, just stay home. Like there should be no reason why you can't stay your ass in your house. Like for real, for real. And I'm sorry for being like so aggressive, but seriously, stay home, wash your hands, wear a face covering, practice social distancing, do whatever it is you have to do to make sure that you're not putting somebody else at risk, because that's pretty fucked up if you are. And I'm gonna just say it like that. Uh, hmm. I should really edit that curse word out, but probably not gonna do that either. So yeah. There's like a few more questions, but this video is coming up on 15 minutes and that's too long for me. So yeah, peace out. I am going to probably go take a nap. I work in the morning. Pray for me. And yeah. Oh, and one thing too, like I've been doing flex shift too. I feel like that's like contributing to like a lot of my stress and like not feeling rested, because I've been doing day shift and night shift, and the recuperation and recovery time is a little different. And you guys know I used to be a night shift nurse. So, anyway, I'm used to it, but it's still stressful. Anyway, I got to go. Bye. Thanks for watching. Thanks for tuning in. Like, subscribe, all that good stuff. Thank you.